Welcome everyone to the Back Chat with the Back Doctor. You've got a very unique and different episode today. You've got just myself, the host, Dr. Oz speaking, and today we are going to be talking about mental health matters. We're going to be really going through the foundational successes, things that need to be looked at, but most importantly is how you can take care of your mental health. Now there's certain key things that we're going to be going over, but what I really want to do is a deep dive into the 5 most common mental health conditions. I want to share some real life stories of struggle and resilience, and I want to explore how to manage these challenges. Why are we talking about mental health? Well, it impacts all aspects of our life, relationships, work, overall well-being. And by bringing awareness, we help reduce stigma around the topic itself and provide support. So just a brief overview of what deep dive we're doing on the 5 most common mental health conditions. One of them is going to be on anxiety. The other is depression, PTSD, substance use disorders, as well as ADHD. These are the most common widespread mental health conditions that you can find today. We're going to explain what those are, how they affect people's lives, and what you can do to manage them better, or even how to recognize if there is an issue in the first place. So if you're excited as I am right now, we are going to get started. So we're going to begin with anxiety. And in a brief overview, anxiety disorders can be also put into a category of a generalized anxiety disorder. So think of it as GAD for short, or GAD. And it's more of an unspecific anxiety that impacts nearly 20% of adults today. Anxiety manifests as chronic worry, often about daily activities or future events. So I want to give you guys a picture. When we talk about anxiety, we're talking about the future. Worrying about outcomes of what's coming up. Could be concerns about the future. Things that are out of your control, that aren't necessarily happening right now, yet they are the biggest concern and the biggest worry that you have. And this is what feeds anxiety. This is what allows people to go from, I've got anxiety, to having multiple symptoms that come associated with it. Sometimes it could be as simple as just not sleeping well. Sometimes it could be the mind racing, and it can even get more severe with high heart rate. Also things like high blood pressure, as well as palpitations, where you can hear your own heart beating. So anxiety can affect people in many, many different ways. And it is normal to have anxiety in stressful, acute situations. So let me give you a beautiful example. For example, you might be suffering from a loved one who is in hospital, who's going through a very difficult time, and there's a possibility that they're going to pass away. And that runs through your mind, even though it hasn't happened yet. And that is a case of acute anxiety. Where it becomes more of a problem is when it becomes chronic. Where anxiety about any small issue, big issue is chronic. It's long lasting. It stays with you constantly. You're always thinking about it daily. And that as a result becomes an issue now. Because it affects all aspects of your life, not a certain case or a situation. One really, really great example and a case study that we've had was Sarah. So Sarah was a 35-year-old teacher who started experiencing GAD during the pandemic, which was COVID-19. So she was constantly worried about her health. She could not sleep well. She could not concentrate at work. So she was, working with children, working with kids, teaching. She wanted to be the best teacher possible. She wanted to make sure these kids were getting the right amount of education. But due to the uncertainty at the time, kids were starting to study from home, jumping online, where she was not able to give her best. And that alone started to affect her ability to prepare, because she was so concerned about the future that she forgot to actually take the steps necessary to prepare herself. So that was just one really, really good example. But with Sarah, a lot of it came down to a combination of things. One of them was, getting help emotionally, mentally as well, but also just communication. So when she would come into the practice, we would, first of all, just address her concerns. We address where she's at right now, and then keep her present in the moment. So things like simple tasks that she would have to do every single day that kept her from looking to the future. These are all things that are very easy to do, stay on top of, as well as treat. Because these chronic issues are usually due to a lack of understanding what the problem is. And once you're able to figure out that problem, is when you're able to get some really, really great changes. So if you have a look at some of the slides, one of the big things is really talking about anxiety. So exercising regularly keeps you in the moment, keeps you present. So Sarah was able to get some more movement into her body, train, use the anxiety stress, the future stress, and channel it into something more important, which is improve her health physically. The second was getting sleep. Because the less sleep you have, the more tired you feel, the more run down your mental health is, the less recharged your brain is. So her starting to take sleep, basically naps throughout the day, getting more and more sleep allowed her to function better. So that's just a really good case of how you can help your anxiety improve in the long run. Now, another area that I wanted to talk about today was really about something I see a lot of people diagnosing themselves with, something that people think they have but may not have, but it is also an issue that's becoming more and more common every single day. And that is major depressive disorder, MDD, or depression for short. Now, just so we have as a rule of thumb, depression only affects about 9% of the population in Australia. Not a lot, but 9% is still very significant. Because if you do the maths on this, let's do the maths on this. 9% of, say, about 2.25 million, 27 million. If you haven't thought of the number yet, is 243,000 people in Australia. So I'll take it back, it is actually quite significant. And these MDDs, these major depressive disorders, these are, again, not an acute thing. They can arise as a result of one acute thing, but they usually happen because they're ongoing chronic issues. And most people that usually have this, they start to have this persistent sadness in their life. They start to lose interest in the things that they love, in the activities that they do, and they start to feel tired, less energetic all the time. And a lot of these start to come as a result of just losing a passion, losing a heart. Now, one of the things that I will talk about is the misuse of a lot of antidepressants in our current culture. So a lot of people that do have depression at one point in their life do seek medication for help, whereas there's no need for it, because depression is a normal thing to go through. The only time it becomes an issue is when it becomes a long-term or suicidal and threatening period. So we need to identify what are the triggers and what are the factors that actually cause you to become depressive. And that can be different for so many people. The mind, the brain is very complex. There are many triggers and many factors, the way you're raised, the way you've grown up, the friends that you associate with, the passion that you have for your job, your work, your career. It can be categorized down into different regions. But basically, the way your body works is that you've got your survival, right? Which is you got to eat, drink, and have a well-functioning nervous system. The second is, you have a job, career, you're hunting, you're gathering. And the third tier is what we call purpose. People that lack purpose in their life are more likely to be in a depressive state. So finding that purpose is super essential to optimizing your health, but also getting yourself out of a depressive state. One example that I'll give is myself. So originally I was not studying to be a chiropractor. I was actually studying to be an engineer. And coming from a Turkish background, my parents wanted me to be in an office job, wanted me to be an engineer, to sit behind a desk, work on buildings, work on construction. I never had a passion for it, but this is what they've sort of pushed me to do. But I was not good at it. I would not show interest in the work that I was doing. So I started to lose interest in activities, wouldn't go to uni, wouldn't socially interact with other people, and I was tired all the time. And a couple other issues and other factors on top of that, then you can really start to see your health getting affected. And when chiropractic found me, that's where I found my calling and I found my purpose. I found the ability to say, hey, I can help other people stay strong, stay healthy. I can form relationships. And that is what gives me that sense of purpose. That's what fulfills me every single day. So really important is having a look at the people you surround yourself with, the purpose that you have in your life. Because when you build strong relationships, you're going to have a stronger mental being, because you associate yourself with people that are like-minded. And if you associate yourself with the right people, not only are you going to communicate more openly, you're going to be spending more quality time, you're going to be becoming stronger, you're going to be becoming healthier, as well as creating more meaning to your life and more meaning to your existence. Because if you know you're helping other people, that satisfies an innate reason inside you. And that doesn't necessarily have to be as a chiropractor. You could be an engineer helping a client create a dream property, a dream house, a dream unit, or if you're a mechanical engineer working on machines. There's many different types. But as long as you're helping other people succeed, you are going to be more fulfilled and less depressive, because it's an inside disorder, not from the outside. And the last topic I want to talk about on this part of mental health matters is substance use disorders. So big thing is right now, other than alcohol, we have a lot of people on opioids and nicotine dependence. And it's actually still one of the major concerns, because these drugs, they coexist with other mental health conditions, and 7% of mental health diagnoses are linked to substance use. So people that continue to take more and more drugs every single day are going to not only become more addicted, they're going to have more issues in the long run. They're not going to be as healthy. They're going to wear down their body's organs. Things like liver failure, kidney failure are very common with these people. And unfortunately, not everyone gets a donor because they're at too high risk to damage the next one, and they'd rather give it to someone else who could use it and use it well. So why do I bring up opioids? Because opioids were originally used to reduce discomfort, reduce pain. But unfortunately, people become addicted to it. It numbs them not just from any sort of physical pain, but it numbs them emotionally as well. And it ruins families. It ruins relationships. And it sends people down in a very, very rapid down spiral. Addiction recovery is the number one factor for people for substance use disorders. You need to have a strong ongoing support. You need someone to keep you accountable, and you need to disassociate yourself with people and other things that surround you with opioid or any other substance use disorder. There's nothing that the mind can't beat. There's nothing that the mind can't overcome. What it requires is the will, the determination, as well as the network of people you surround yourself with to help support you and guide you through this story. Now, one person I can give a really good example of is Jesse. So Jesse was a 28-year-old retail worker who had unfortunately gone through a surgery for their back. Now, opioids was prescribed because the back pain after the surgery was quite significant. Unfortunately, opioids are quite addictive. So over time, those use of opioids increased and it became an addiction. This addiction for Jesse had now affected the family. His mum and dad, his communication with them, the fights, the arguments that I had heard were things that you never want to hear. He would not even start to attend the appointments here in the practice. He would miss. He would become more inconsistent, more sporadic. And it wasn't until just really bringing him down, bringing him to a consult room, sitting down and chatting with him, asking him to seek help, that we care about him and this is not who he is where he started to make a change. Going through rehab, going through a 12-step recovery program, counseling, Jesse was able to rebuild his life and start to make the change to improve significantly. There's nothing that the mind cannot beat. There are some other techniques you can always do for stress management, for emotional stresses. Some of these are what I like to call mindfulness meditations. So you just, for anxiety, you practice being present. For things like relaxation, you can do deep breathing, yoga, progressive muscle relaxation may help as well. And finally, time management. I only got 24 hours in the day and I got no time to do anything. What a lot of people don't realize is that the more organized you prepare your day, the more time you give yourself. So you need to learn to prioritize your tasks. You need to learn how to schedule, and you need to learn how to create time for yourself. And when that's done, you have more time to focus on yourself, reducing the stresses. Whatever de-stresses you, whatever improves your mental health, you'll have more time for. Now, we've only covered 3 out of the 5. So we will do a second episode of this podcast where we're going to focus more into PTSD and children's ADHD disorders. So I wanted to thank everyone for this very unique and very different episode of the Back Chat with the Back Doctor. I'm always looking forward to hearing feedback. Any questions, you can always reach out to us. And I'm wishing everyone a lovely, lovely day, night, evening, afternoon, whenever you are listening to this. Thank you, and have a great, great day.